thanks. So I'll go ahead and call to order the joint meeting of the Travis County Commissioners Court and the City Council, and we'll take up item 1 to receive briefings on COVID-19 and related matters. And Shelby, any callers? Looks like we don't have any callers, but can you confirm?
Good morning, Judge. There are no callers at this time.
Okay, thank you. All right, so as per usual, we're going to get our briefings on COVID-related matters, and we've got, as seems like always, a pretty full agenda after this. Some things that we have to get to before lunch because of other things that rely on that happening. So if possible, if we could try and limit ourselves to about one question. In the order below, we'll go through the commissioners and then the judge and then the city council members and then the mayor. And I will turn it over to Dr. Welks to get started.
Good morning. Good news is that we have full approval of the Pfizer vaccine. So here's hoping that those who were hesitant to be vaccinated will now go forward and get vaccinated to help with ending this pandemic. Our numbers, as of yesterday, we had 708 cases that were reported. Next slide, please. To Austin Public Health. Yesterday, our 7-day moving average for hospitalizations is at 80. We have 638 patients in hospital. 232 of them are in ICU. 162 are on ventilators. The previous 24 hours, we had 64 admissions, 69 discharges, and our curve is showing a continued increase. We've surpassed our ICU numbers from previous spikes. Our ventilator use has also increased, and we need our public to do what they can to help us with decreasing these numbers so that our ICU capacity will not continue to be stretched. We need higher adherence with masking, social distancing, limitation of large gatherings. We really do need children to be protected in school. As we know, when children go back to school, it's a congregate setting, and they are not able to social distance as much as adults can. So all of those things that we've done before in previous surges to get through and decrease the spread of our case numbers is what we're going to need to call upon the public to do at this point. On the left-hand portion of this slide, you see the UT modeling projections that show opening schools with compliance with mask wearing at a moderate level will help keep the numbers down, but will still surpass our projected ICU capacities. With high compliance with masking, we can achieve lower numbers and not stress our ICU capacity. So that is what everyone in our community and all of the leaders of our community are striving for at this time. Next slide, please. Next slide, please. With the opening of schools, at this point, we are seeing a surge in cases. The last year at this time, we had school reopening delayed, and we had masking in place. But as of the last 2 weeks, we've had increase of cases up to 414 additional cases in the last 2 weeks. There was some talk early on in the pandemic that said that they didn't feel like there was transmission from children to adults. However, a recent Canadian study shows that there is indeed transmission from children to siblings and to adults. Those previous reports were thought to possibly be due to the fact that children were not in school as much early on in the pandemic. So we are seeing transmission. And let me repeat, masks stop the spread of COVID-19. So it's important that our children rely on us to protect them by sending them to school with masks at this point in time. If you look on the right-hand side of this slide, with the decreased use of masks during the summer, and with the introduction of the Delta variant into our community, we're seeing a concomitant increase in the numbers of cases of COVID in pediatrics age groups, those under the age of 18. We've had 90 so far during the July and August timeframe that were admitted to hospital, and 26 of those have been admitted to ICU. One has been on a ventilator for many weeks. That child has some underlying comorbidities and medical conditions that have made their case and their disease process more protracted. Next slide, please. The death rate that we're seeing in our community is slowly increasing since the introduction of the Delta variant. We've had 26 additional deaths since August 1st, and this slide was produced late last week. It doesn't record some of those that happened over the weekend. However, overall, in comparison to some of our surrounding counties, Williamson and Hayes, we are still showing fewer deaths than those counties that surround us, and we're also showing fewer deaths than historically trending in other major metropolitan areas and counties that have those major metropolitan areas. If you can move to the next slide, please. Our admissions have increased over time, but you will see that last week over this week, we have had fewer admissions. But this does not account for those in hospital whose COVID disease has progressed to require additional and more intensive care. So we have people over time who have COVID, who progressed to severe disease, require supplemental oxygen either in the form of high flow oxygen, ventilation by ventilators, or ECMO therapy, which is, you recall, is a therapy by where your blood is removed from the body to allow your heart and or lungs to rest. Your oxygen is replenished, carbon dioxide is removed, and your blood's put back into your body. So even though we're seeing a slight decrease in the number of admissions from last week to this, there is a portion of those who were admitted in previous weeks who remain in hospital. And that will continue to accumulate the numbers of people that are requiring ICU care. So this slide is looking at admissions. It doesn't look at the full picture, the full impact on our ICUs, and it is still important for us to do what we can to mitigate the spread by wearing masks for the short term, social distancing, staying home when sick, staying home if you're unprotected, by being vaccinated. And it's very important for those who are not vaccinated to be vaccinated. Next slide, please. This takes a look at the breakdown of where people are coming from to be admitted to hospital in Austin Travis County. And we see that 52% of individuals admitted are from Travis County, with 23% approximately from Williamson County, and then other counties surrounding as listed. And there's another listing here on the left of the zip codes from which people are coming to our hospitals for admission. And if you look at these numbers, you will see that they are matching up with where we're seeing lower vaccination rates. So it is important that we continue to spread the message to the community that vaccinations are safe. We now have full approval of the Pfizer vaccine. So if there's any question about its safety, it's been validated and approved by the FDA, and now's the time for people to go and get vaccinated. And it's very important for people to wear masks and avoid large gatherings, stay home when they're sick. Next slide, please. Last week, we had the recommendation publicized that the boosters of Moderna and Pfizer are now recommended, and this slide's depicting what that information was based on. If you look to the right, this is a study by Curry that shows that over time there is a decrease in the effectiveness of vaccine. This is not an unusual phenomenon. Everyone is familiar with needing a booster of, for instance, the flu vaccine yearly to protect against developing that particular viral illness. And it's not unexpected that that may happen with COVID as well. The dotted line is the projection of effectiveness of protection against severe disease over time, and it shows that at 250 days that the protection against mild disease is seen to wane, but there's a larger waning or decrease in the protection that's given for more mild disease. And when you look at something like the Pfizer vaccine that started out at 95% protection from both mild and severe disease, you see where we are now is somewhere close to that 250-day mark for those who were initially vaccinated in the December-January timeframe. If you look at the graph on the on the left, you'll see that we're looking at what our data is showing for the breakthrough cases that have occurred and have been reported to APH. And this represents 3,642 confirmed breakthrough cases. Our case investigators have been able to reach 896 of these individuals. 42 of them were admitted to hospital, 3 of them were long-term care facility residents. So of the over 1 million doses of vaccine that have been given in Travis County, only 3,642 were confirmed as breakthrough cases. There may be some underreporting of that, but you'll see that even with that, the numbers of breakthrough cases are relatively low. And this also shows that most of the cases have been mild, not requiring hospitalization. So truly, the vaccines protect against severe disease, ICU admissions, and death. And you also see that in June, the June timeframe is when you start to see our bar graph present itself more, and there is a clear spike that's noted in the July-August timeframe. This also correlates with the emergence of the Delta variant and the current surge that we're seeing. So the boosters are necessary for those who have been vaccinated, and it's all very, very important for those who are unprotected and unvaccinated to go and get vaccinated, because these vaccines are protecting against severe disease, ICU admissions, hospitalizations, and death. So please get that message out to your constituencies that vaccines are part of the plan that will help us to end this pandemic. Boosters are now available to immunocompromised individuals, and as of September 20th, others who are 8 months post their first series of vaccines will be eligible to present at any one of the many providers in our county for vaccination. And finally, our herd immunity has changed slightly since my last presentation. There's been a 1% increase in those who are partially vaccinated. So we now have 10% of our community partially vaccinated. We have 56% of our community fully vaccinated. And then we have 11% of our community that's vulnerable. This number continues to decrease. I'm hopeful that with the full approval of the Pfizer vaccine, that those who were hesitant in the past will get out there, get vaccinated, and get us to the other side of this pandemic. We say that we want to protect our neighbor by wearing a mask. We want to protect ourselves by wearing a mask. But we also want to protect ourselves by being vaccinated. And truly, it is important that all who are not vaccinated avail themselves of that opportunity so that our schools can be reopened, our children can be safe, and with masking, we can protect those who are unvaccinated in our school systems and continue to keep our schools open. These first couple of days of school reopening have shown that there are many, many children who are going to be affected by COVID-19 if we don't protect them with masking. And I hope that all of those who are concerned about this issue will continue to stand with myself and others as we try to keep our children protected with masking in schools. And with that, I'll end my presentation. Thank you.
Thank you, Dr. Wilkes.
Thank you, Dr. Walks. And now I'll give a brief update on our the operational side of things. If you are sick, please get tested. If you are exposed to someone who tested positive, please get tested. And when in doubt, please get tested. Austin Public Health continues to stand up testing operations at Dove Springs Rec. We have our drive-through at St. John's. If you need in-home testing because you're homebound or unable to visit a testing site, you can call 311 or 512-974-2000 to have someone come out and provide you a test. If you have insurance, there are other testing options and providers that are available. Please feel free to call your primary care physician if you need to get a test. We can see over weeks that the demand for testing increases. Last week, we gave almost 4,000 tests. 3,773 tests were administered by Austin Public Health. When we look at our vaccine dashboard, you can see the total amount of doses delivered by Austin Public Health and Community Care are now at 453,000. Over the past week, we delivered 1,370. That's still not where we would like it to be as we're pushing vaccine. We want to see numbers that mirror the earlier part of the year. According to DSHS, 77% of the population that is eligible has at least one dose, and 66% of the eligible population in Travis County are fully vaccinated. This data is current as of yesterday evening. We still have 250,000 people who are eligible for vaccines that have not been vaccinated. This increases the potential for hospitalization and even death if they remain unvaccinated. And so again, we're really asking the community to be proactive, to protect themselves and their loved ones, and get a vaccination. When we look at the Texas Department of State Health Services vaccine data broken out by race and ethnicity, unfortunately, the story isn't changing for our communities of color. I am happy to announce or to see that we're over the 50% mark for at least one dose in our Hispanic and Latinx population, but still have some way to go for our Black and African population. They're just over 38%. And then when we look at those populations for fully vaccinated, the numbers there are still low, 42 for Hispanic Latinx and 31 for our Black and African American populations. And so our efforts will continue to focus on those gaps, making sure that our operations are designed to meet the specific and unique cultural needs for those populations. For a point of reference, the total number of shots given in Travis County are 1,505,031. When we look at our map here, it's still good because there's a lot of green, but there's still work to do to get those blue areas into the green space. And again, those are 1742, 5853. When we look at the second dose map, um, areas of focus are these red areas here, which are 78617 and 78753. And so we'll continue to partner with the Travis County Vaccine Collaborative to make sure that we are having enough boots on the ground information, not only to, or operations rather, not only to give out shots, but to really provide information to the community so they can make good decisions. The science changes daily, and I know it's a lot to keep up with. And now we're throwing boosters into the mix. And so as we stand up our teams that will very soon include community health workers, we're hoping to provide enough information to support folks in getting their vaccinations. And to that end, here's a slide that shows all of our vaccinations for this week. The standard three are there: Southeast Library, Little Walnut Creek, and the Anna Lark Center. We'll be at Maynard New High Tech, at the Cristo Rey Catholic Church, and at the Terry Road Baptist Church, and of course at the Del Valley Opportunity Center in partnership with Travis County. We'll be at approximately 27 pop-up events this week, including the Mexican Consulate and 4 ACC campuses. For a complete listing of our vaccine locations, you can visit us at www.austintexas.gov/COVID-19. And again, we have our goal in front of us as a team. We know that there are 250,000 folks who are out there that still need vaccine, and we're going to focus on that group and convince and make vaccine available in locations and at times that work for busy schedules. And then last but not least, it's not only about vaccinations, right? We understand that as a community, there are several impacts that COVID have that impact our overall health. And so these photos are at a food distribution event that took place at the St. John's Recreation Center this past weekend. Not only did we pass out fresh food for families, but we also gave out PPE and information about testing and vaccinations. The staff served over 619 families in the blazing heat. So thank you to the mobile team who were there on the ground. Thank you to ATD who provided logistical support. Um, as always, I am grateful for the staff at Austin Public Health for the work that they do in serving community, not only with vaccinations, but with testing, with contact tracing, with all of the operations that support our community in getting through this pandemic. Special shout out this week for the health IT team in getting our systems ready to accommodate folks for booster shots. We have began giving out booster shots for folks who meet the criteria of being immunocompromised. And we will continue to roll out our self-serving platform where folks can make an appointment online if they already have an account with us, or they can walk up to any location and get a booster. And with that, I will end my comments. Thank you.
Thanks, Director Stirrup. Chuck or Chief Bailey or Constable Morales?
Good morning, Judge, Mayor, Commissioners, and Council members. Chuck Brotherton, Travis County Executive Emergency Services. This morning, of course, we will hear from Constable George Morales with Precinct 4 and Fire Chief Ken Bailey with Travis County Fire Rescue. And I'll turn it over to Chief Bailey.
Good morning. I'm going to try and share my slide. So the collaborative in the last 7 days has delivered about 1,611 shots. 53% of those were first doses and 47% were second doses. We are now prepared to start to deliver third doses, and over the course of the last week, we did 5 third dose injections. Our total for the collaborative right now is 29,000 shots. We are starting to see, we saw an uptick in first doses, and we are starting to see the convergence of our first dose and second doses, which traditionally has indicated a waning effort of people to get vaccinated. We have performed or have planned 322 separate events, mostly in the hard to reach areas. And in this slide, I also wanted to just kind of give a highlight of what I was speaking to in regards to our first doses versus our second doses are starting to converge once again. John Lawler and Constable Morales' team has done a really good job of getting out there, and I'll turn it over to Constable Morales to talk about that outreach effort.
Good morning, Commissioners, Judge, Council members, and Mayor. We continue to focus our outreach and education doing the work to ensure that our strike teams are successful. This week, we have done a total phone calls outreach of 6,381 with a total contact of 24,321. Our mobile teams gave a combined 1,610 shots this past week. Bailey gave us an extra shot there at 1,611. With a combined shot for August of 5,165 in our hard to reach Austin Travis County areas. We completed the shot locations this week in Pflugerville and Wells Branch with the help of Commissioner Shea and Commissioner Trevelyan. In Pflugerville, we will have 2 static locations. One will be at Foothill Farms. The other will be at Black Hawk Community Center. We continue to work with AISD, DVISD. We will have 1 static location starting, I think, in September at Mendez Middle School, and then some surrounding elementary schools in the hard to reach areas, and also the highly affected COVID areas. We will be working. We did a shot clinic at Camp Esperanza. I don't want to miss that, and we were thankful for Commissioner Gomez and Congressman Doggett for their support on that. But I really want to give a shout out to Stacy Suits and Julie Nitch. Because their work with the homeless community is great, and we were able to have a real good clinic there. Last thing we did was we did a shot clinic at the Travis County Justice Center with the Project Connect and Engage folks with Mueller. We want to thank Constable Carlos Lopez and his team for being out there and helping us coordinate that. As we move forward for this week, we look at several new locations. Is second dose clinic at the Dove Springs Recreation Center, Lake Travis Methodist Church. We'll continue to be there twice a week at Houston-Silson University. Linder Elementary will be a second dose clinic. New grocery store is Poco Local grocery store, and again, San Jose Catholic Church for a second dose clinic. And I'll turn that over to Chuck.
Thank you, Constable. Folks, as I like to do, want to show our viewing audience just how easy it is to find vaccination location information on the Travis County website on our landing page. One click here takes you to our COVID-19 information with vaccine events in a handy calendar. This is Tuesday, August 24th. You can see how many different locations we will be at today. Like to highlight the JD Markets where we appear on Tuesdays and Thursdays. But click on any link and you see the time, the address, the type of vaccine. On the austintexas.gov landing page, also one click in, find locations for a free COVID-19 vaccination, and you will find, again, information to find locations. And then for private providers, vaccines.gov will help you find a pharmacy in your neighborhood where you can easily obtain a vaccine. So we continue our operations in cooperation with Austin Public Health, Travis County, our vaccination collaborative. We are at the Travis County Expo Center at 7311 Decker Lane, Saturdays and Sundays, 9 a.m. to 5 p.m., doing drive-through vaccinations. The expo is also the host site for our regional infusion center, which is by physician referral only, of course, but folks can get a monoclonal antibody infusion there. And we are setting space aside at Expo for an alternate care site to relieve pressure on our regional hospitals, should that be needed. But all of that effort at this point is focused at the Travis County Expo Center. So I will stop there and turn it over back to y'all for questions. Thank you.
Thanks, y'all, very much. I'll turn it over to Commissioner Gomez if you have any questions.
I don't have any questions, Judge, but I just continue wanting to thank very much to the collaborative team for going out and seeing people where they are and convincing them to get vaccinated. And so that's the end goal here. And it's true, if we don't get vaccinated, we're going to be hospitalized or we're going to die. And I'm very appreciative of the PSA that Pope Francis put out this past week about each person needing to show a little love for yourself, get vaccinated, and show a little love for others so that they don't get infected. And so this is about living, about having life, and we need to take that step. Thank y'all.
Thank you, Commissioner. Commissioner Shea?
Thanks, Judge, and thanks again to all of our staff. You guys day in and gals day in and day out are continuing really amazing work to keep our community safe. My question really is with regard to the booster. Do we have a kind of a central location where people can get basic information about it, even if we're not ready yet to start rolling things out? Can we at least direct people to one site, one location where they can get information? Because we're starting to get questions about it.
Yes, ma'am.
No?
The APH has information on their website and on their social media feeds, and I'll let Adrian add in as well.
Nope, you took the words right out of my mouth. On that page that Mr. Brotherton landed on about vaccinations, there's also information about boosters. Folks can call in to, as I said, schedule an appointment, ask for information, and we're offering them at any of our locations that we're giving out vaccines. You can come and ask for a booster shot. Just make sure that it's a location that offers the shot that you received initially, and we are staging operations so that we'll have both vaccines available, so folks won't have to make that choice.
And do people need approval from their doctors?
For boosters, right now, according to the guidelines from DSHS, it is self-attestation. Our website lists the information that helps people identify whether or not they are immunocompromised. If you're still speaking, ma'am, you're muted. I couldn't hear you. I saw your...
Nope.
We're not needed on my end, but thank you.
Okay.
Thank you. Commissioner Trevelyan?
Okay, once again, I want to sincerely thank the team for reaching into communities and putting up the types of strike teams that are necessary to to go into places that are not easy to access. I think that the team that's been putting those resources together has been exceptional and has made a real difference. And we're hearing about them when we go to football practices and talk to booster clubs and whatnot. They are aware of you, and we wanted to make sure that we continue on along the lines that you're going. I'm still interested in how we continue to build that trusted community member, those trusted community institutions. And along those lines, I'm wondering whether we have worked out more of the details for the pipeline that will allow us to train medical personnel. I know we've talked about it. There are a number of groups out there. I know the local workforce board, I know Capital Idea, but there are a number of groups that work more closely with communities. And I'm wondering how far along have we gotten to making sure that there's a pipeline so that people who are interested in working in the medical field and would be trusted members to a lot of community folks have the opportunity to be trained and work in this area. That might be a Chuck
Yeah.
question.
Commissioner Trevilian, I hear your call to our healthcare systems to make sure that they are accessing that pipeline for talent. I know that the contract that the county has executed with Ascension Seton to build the team that is staffing our strike teams that are in the communities day after day. Those folks are hiring from across the region, any available qualified person. So it just continues to be something that we have to stay in touch with our colleges and universities to make sure that those programs are continue operating and that we continue reaching into them to pull talent into the work that we're doing.
And I appreciate Ascension Seton and the work that they're doing. I just think that there are a number of groups that are closer to ethnic communities and are closer to neighborhoods and fulfill that trusted organization space. And I just want to make sure that those groups are connected with Ascension Seton or Capital Idea or ACC or whomever, because there are some, Ascension Seton is a wonderful organization, but there are some areas where they need help from trusted community organizations. And I'll be happy to sit down with you or sit down with anybody on your team and help identify some of those groups and where they're already working, the results that they're already getting, because I think there's only so far that large organizations can go into communities. I think one of the reasons that the strike team is so effective is, you've got a constable who grew up here, who's a part of a neighborhood, who is consistent there. I think that there are other community resources that we have to call on in order in order to penetrate the communities in a way that we haven't done so far. So I don't want to sound like a broken record, but there are some resources that we're leaving on the table. And given what's going on with the variant today, we don't need to leave anything on the table.
Thank you. Commissioner Howard?
I had a quick question maybe for Adrian. Can you point on the website where I can direct people to who need a replacement vaccine card? I've had to call on some special favors and I'd like to be able to do it myself, but I don't know where to go.
And so I'm not certain that if there's a spot on the website, but if folks have contacted APH through 311 and they have in fact received their vaccinations through us, we can assist with that. it becomes more problematic if they got their vaccines from someplace else. So for right now, I would continue to have folks call 311 or 512-974-2000. And I will get with the GIST team to make sure that we have a spot on our website that offers those directions as well.
Thank you.
Thanks. Hey, Constable Morales, first of all, y'all are doing amazing work. You and Chief Bailey and the whole team over there.
Yeah.
1,600 doses in a week is great. And it looks like, again, it's the communities that we're trying to increase the percentages in. So I want to give you a shout out for that. Could you discuss anything, kind of picking up from where Commissioner Trevelyan mentioned, are we looking at doing canvassing to where it's actually going to people's homes or anything along those lines? Would you mind?
So Judge, our outreach teams do block walkings. Again, I explained to some staff members that we try to hit it early in the morning where it's cooler. But we have been in the areas that have been affected highly. And the goal there is to right now push people to the shot locations that are nearest to them. And then we also leave a phone number for those that are do not have the resources to get to those clinics, and we provide a home shot for them. And that number is strictly listed on the flyers that we put out there. That number is 512-854-SHOT. As we continue to go out into the areas, we also started mailing out this week. 1,200 mailers just went out this week into areas where pop-ups are going to be showing. An example is the Dove Springs Rec Center, San Jose Catholic Church, Black Hawk Community Centers. That's, some areas we can't get to, like apartment complexes that are gated. So we're going to be mailing into those. Mobile home parks that sometimes they're just fearful when people are just walking around the area and they want to be a little bit more private. We're going to be mailing into those areas.
Sounds great. Thank you so much. Mayor, I will pass it over to you.
Judge, thank you. Colleagues, we're going to start with the Mayor Pro Tem, work our way into District 10. Is the Mayor Pro Tem with us? You're muted.
Oh, my apologies, Chair. Did you recognize me? We're having some trouble with the first day of virtual sixth grade. My apologies, everybody. And that's actually a really delightful segue into the most troubling part of all of this for me. So I'll reiterate my colleagues' appreciation for all involved in doing this incredibly difficult work. And I just want to be clear about expressing my biggest concern right now, both from a personal perspective, as I have a 7th grader who's at a school that's up to their 5th case this week, rolling into the 2nd week. I'm very concerned that we will find ourselves in a position where our scholars are encouraged to resume virtual learning. And I don't know if that's a Austin public health /AISD question, but if I can ask the part that you are able to answer, whether or not that's something as a parent that I should be expecting or that other parents should anticipate as a possibility. And then I also had a question about, I was told that our ventilator use this time around is up some incredibly high percentage. And I wanted to know if that is in fact the case and what the plan is moving forward for having appropriate equipment for treating patients who need ventilation.
For the first part of your question, or first question, yes, the school numbers are very troubling, and the decisions about changing the processes at school will be made by the independent school districts. So we're just waiting and watching to see what changes will be made. It's going to be done on a case-by-case basis because we're unable to have the impact and the input that we had in the past year when school started. So we're just waiting and in constant communication with the ISDs as the numbers start to become clear. With regards to the ventilator use, there has been an increase in ventilator use, but we have been able to keep up with that. We have a lot of ventilators available to us in the Strategic National Reserve. So at this point, we're doing okay with ventilator use, and CATRAC has been able to issue ventilators to those hospital systems that have been requesting them. This situation is very surreal because what is happening in our hospitals is very, very concerning. And what's happening outside the walls of the hospitals is very much, in many instances, looking like business as usual. And it's really important for all of us here assembled for this meeting to translate the reality to our people. We need to be masking, we need to be getting vaccinated, and we really need to stay home if we're sick, get tested, and avail ourselves of the opportunity of treatment with monoclonal antibodies early on when we discover that we have COVID-19, so that we're not progressing to illness that requires hospitalization.
Thank you. I really appreciate that. And I do so hope that we can do a better job this time around than we did the last time, watching our constituents struggle to figure out childcare and meals that they anticipate their children receiving through our school systems. I mean, just all of the logistics that go into having a working parent and children. They didn't have enough time to prepare. And I think the lurch that we left everybody in just by not, I mean, I'd rather we, with an abundance of caution, react too abrupt, too overreact. I think is the word I'm looking for. I would rather we overreact than underreact, because watching our families struggle to recover was just heartbreaking. And I really hope that we don't have to watch that happen again. Thank you all very much. I appreciate your time.
Thank you.
Thank you. Councilmember Fuentes.
Thank you. Colleagues, we know that President Biden, the Biden administration has announced that they will be releasing booster shots beginning the week of September 20th. And so certainly it's great to hear from Director Stirrup on the work that we're already doing here with the city and with Austin Public Health around the administration of booster shots. And I'm happy to hear that APH is in conversation with our IT department to ensure that we're up and ready to meet the moment when we have a surge of individuals who will be ready to take their third vaccine shot. And so I will be bringing forward policy direction on Thursday at our council meeting that sets forth a booster vaccine strategy that is rooted in equity, that ensures that we are having space to talk about lessons learned with our initial vaccine rollout, and also ensures that we have a robust public health education campaign. And with the investment that the city recently made with community health workers who are going to be our front of the line agents to help us address some of that hesitancy that we're seeing in our hard hit communities, I think that will go a long way. So the question I have, Director Stirrup, is, I believe you mentioned that we still have about 200,000 Austinites that have not yet received a vaccine. Can you talk us through, with the recent announcement of the Pfizer vaccine receiving full FDA approval, how are we really leveraging this moment to educate our community? Well, we already know that the vaccine is safe and effective and that you should get it as soon as possible. What's the plan there to really promote that has full FDA approval to address some of those hesitant individuals that make up that 200,000?
Thank you for that. I think it'll be more of it will be more of the same of what we're doing. At our media availability on Friday, we will take that opportunity to spread that message even further. our GIST team, our Joint Information System, is working on a campaign to begin to push that out again through social media. So it's a 3-point tack. We want to make sure that people know about the mononuclear antibody infusion treatments. We want to make sure that people know about boosters. And we also want people to know, like in a simple layman's terms, what it means about the FDA approval and the safety and the efficacy of those vaccines. And so we will be using the strategies that we've had in place before. So it'll be the social media push, we'll be on the radio, we'll connect with our community partners that have been boots on the ground and supply them with information. And of course, our street teams will have that information as well.
Thank you. That's really great to hear because I know in my conversations that I've had with community members, one of the most common feedback that I receive is that the vaccines were rushed and they came out too fast and I don't know, it was too quick. And so I think really having a plan in place to promote, well, it's been fully approved, it's safe, go get it, go take the shot. That's going to go a long way. So thank you. Thank you so much for your work.
Thank you. Councilmember Renteria.
Yes, thank you. I just want to also say thanks to all the people out there, distributing the vaccine and trying to get people. I can imagine how frustrating it is to constantly be going out there and begging people to get their vaccine, get vaccinated. It really just disappoints me. I have parents that say, "Hey, when y'all going to open up the gym? My kids want to go back into boxing or playing basketball." And here we are in stage 5 again, and we can't open up our gyms so that our kids can go out and play and participate in sports. So, this is very disappointing, and I share the frustration because I have family that are stubborn also, and not even force them to go down there and take that shot. You're willing to pick them up and take them to the location, and they still say no. So it's just frustrating, and I hope y'all come into realization when, before your kids end up getting sick, or you yourself get sick, or somebody that you love gets sick and end up in the hospital. So all I can say is quit being so stubborn and go and get vaccinated.
Thank you. Councilmember Kassar.
Thank you. I want to second what folks have said about taking this moment to convince folks to change their mind. And I've had recent conversations with constituents who have changed their minds. And I think it's important to tell those stories, to say, look, there are some people just like you who didn't want to get vaccinated, but now with this news have changed their minds. Why don't you do so too? So we open up the door for people to do that. My question, Dr. Walks, is I think I followed the 4 charts on the declining efficacy over time, but because they weren't really clearly labeled, I've already gotten questions from people saying, wait, what does each of those 4 charts mean? Can you just walk us through one more time what the assumptions are for those 4 charts that showed the declining efficacy over the course of the 8 months?
Sure. So the charts allow for whatever the beginning assumption was as far as efficacy was reported. So for the mRNA vaccinations, Moderna and Pfizer, they were 94.5 and 95% each as far as their efficacy was at the beginning. And with time, the amount of protection against severe disease or mild disease. Mild disease is the solid line. The dashed line is the severe disease. And that lower right-hand graph would be the one for the 95% efficacy mRNA vaccines that are available here in this country. And that shows that over time at the 250-day mark that we're seeing that level of drop in the efficacy of the product. And And on the left-hand side, that's kind of illustrating what we're seeing in our community that goes along with that. And the fact that we have so few breakthrough cases after delivering over 1 million plus doses shows that, yes, it is protecting. The fact that only 42 of the 3,600 cases were hospitalized shows that this disease that we see represented on this graph was mild. And so it is still protecting against severe disease for the most part. So that's what these two graphs are representing.
Thank you. And just to be really clear, with the focus on the right side with the 4 smaller graphs.
Yeah, so that was done because there's several different vaccines out in the world, and they don't all have the same efficacy. But the ones that we're talking about, particularly in our country, that are most widely used are the mRNAs that are at 95%. So that bottom right-hand corner is the one that applies for our scenario.
Right. So people should really focus on the bottom right-hand chart, look closely if they got Pfizer or Moderna.
Yes.
And the dotted lines are severe disease and the solid lines are more mild infection. But they should
Yes.
really focus on the bottom right one. And then the difference between red, purple, and blue is?
Just one sec. I need to pull up my key.
Seems to talk about half-life of 10 years, but I think some folks might really want to know in layman's terms what that means for them.
That's not going to be as easy to give you. It's a long paragraph. Can I send you that and let you have it for your?
That's fine. I think just for the
reference?
average person watching or reporting, which
Yeah.
of those lines for a person that got Pfizer with public health or the collaborative, which line should they be looking at or thinking of?
The blue.
The blue line.
Yeah.
Okay, so for us right now, people generally should be looking at the bottom right chart and the solid blue line for mild infection and the dotted blue line for severe disease.
Right, exactly.
Just so that folks aren't looking at, say, the top left chart and looking at the solid red line. That wouldn't be a good way for people to be reading this chart for what this means for themselves.
Exactly. Thank you.
Okay.
And I'll send you
thank you.
I'll send you that other information. In fact, I'll send you the article.
That's fine. I'm happy to take a look at it. I just think that there's just such a large difference between those scenarios. So thank you for that, Dr. Wilkes.
Thank you, sir. Thanks for the question.
And thank you, Councilmember Kitchen.
Thank you. This is all very helpful information. I have, in the interest of time, I'll just ask one follow-up. And then I would just ask also to be, with regard to nursing facilities, I'd like to have an update on what's happening there, but we can take that offline. And then perhaps at our next joint briefing, we can get some more information on what's happening with with people living in nursing facilities. So
Yes,
my
ma'am.
day is just, can you help me understand if there are any targeted efforts occurring at the moment in 78745?
Adrian,
I
do you?
in the past, I'm just trying to remember, or just wanting to understand what the current status is. That's one of the zip codes that is somewhat lower with regard to vaccinations.
And so I am aware of the mobile vaccine program selecting locations in that area for vaccinations, and they're kind of taking advantage of, I can't ever remember what the marketing term is, but when you're in the checkout aisle and they put all those candies there that you really don't need and you just buy one. So we're really trying to create those easy opportunities for folks to get vaccine during the course of their day. And even when they're leaving a scheduled site, they've reported back that they've stopped at, work locations or restaurants and just asked people, hey, do you want to be vaccinated, especially if they have leftover shots. We are building off of the model that Constable Morales and his team put forward. And as we're hiring community health workers, they will too use data to figure out locations where that kind of boots on the ground information would be most useful, and either set up locations or events for the mobile vaccine team to come in and give shots or drive people to locations.
Okay,
I can provide more specifics about the activities and the events at the next briefing if you would like.
yes, that would be fine. And also I'm curious if this is one of the areas that the constables have been going door to door.
So yes, it has, council member. We have been into the Emerald Forest area, Cooper Lane area, South First and Stastney area, William Canyon and Manchac.
Okay,
And we have 3 actual locations identified in those areas. One is La Michoacana, one is QC Market, and another one is a pop-up.
okay. Thank you very much.
Thank you. Councilmember Kelly.
Thanks. I don't have a question today, but I do have a story I want to share. So as we've all talked about, vaccine hesitancy is a real thing in our community. And recently I was able to convince my 77-year-old family member to get vaccinated. And I just want to thank Austin Public Health for being able to provide that opportunity to my family member who's homebound and watching right now. I'm really proud of you for getting that vaccine and making that personal choice. And with that said, I want it to really be known and to resonate in the community that we can all be advocates for the vaccine and we can all continue to talk about the benefits, and we really should, for the safety of our community. Thank you.
Thank you. Councilmember Poole.
The only thing I'd like is a little bit of explication on the percentage of prevention that the vaccines offer. When it came in at 95%, for example, my understanding was that was pretty high, and the normal preventage percentage is something lower on vaccines. And so the reason I'm asking that is I wanted to put the lowering percentage numbers into the context of what is expected from a vaccination and rates for prevention.
So we usually, with a flu vaccine, on many years, we don't get more than 50 to 60%, sometimes 70. When they initially started asking for submission of data for the vaccine candidates that were being worked on, they were looking for something that was at 70, but that's pretty high. There are years when we don't quite get all of the variations of, for instance, the flu virus that's circulating in our community, and sometimes the flu vaccine is not as effective, and people will get mild illness for that reason. And so, having said that, the hope was to get something along the lines of 70% at least when they were requesting that these vaccines were developed. So that's a good level. And with the decay that we're seeing here, even at the 250 day mark, we're in that range of about 70%. And we're seeing the level of breakthrough that we're seeing here, based upon the fact that we not only have, well, actually predominantly right now we have the Delta variant. So that's why we're seeing the level of breakthrough that we are seeing. But even at that rate, it's not that bad because it's 3,400 cases total over that period of time. And there have been, as I said, over 1 million doses delivered. So we're still getting good coverage and good benefit from having been vaccinated. We're taking that extra step to boost our immunity because, as we know, we have over 200,000 individuals in our community alone, and only 2% of the world is vaccinated. So there's still a lot of fertile ground out there for this virus to mutate again and create yet another variant. So it's really, really important for us to not only vaccinate ourselves, but for the world to be vaccinated so that we don't develop any more mutations.
Right. So the takeaway for me there is that a very high rate of efficacy, and even with the decay, it's still at rates that are much more, provide a lot more protection even than our annual flu vaccinations. And with the FDA approval that happened yesterday, and the fact that these vaccines are so easy to get in our community, I just urge everybody who has not yet gotten their shot to go out and get the jab. And that is your job, is to get the jab. Thanks. And thank you to our staff for continuing at a time when I know they must be emotionally and physically exhausted. Thanks so much.
Thank you. Councilmember Ellis.
Thank you, Mayor. Dr. Walks, could you go into a little detail about guidance for outdoor events? We've seen situations where some voluntarily canceled their events, like Blues on the Green, and also ACL recently announced that it's going to be requiring vaccinations or proof of negative tests. So I think there's a lot of folks that are curious over the next couple of months what to expect for outdoor events. What can we encourage as a city, especially on things that are on public land? Or should there be any changes in expectations in the future that you see people should be aware of right now?
I think that the reopening of schools is going to have a large impact on our community with regards to the numbers of cases that develop, particularly if we don't mitigate and have mask wearing. And so as that unfolds, we're going to see that we're going to have to revisit our expectations and what we can do in our city. The way that this virus spreads is through social interaction that's unprotected by masking and vaccinations. And so at this point, we are looking at advising policymakers and making recommendations that are going to put in place guidance that's based upon the fact that our situation is changing in the wrong direction. And we don't have all of our citizens vaccinated. We have a lot of cases in our hospitals. Our ICU capacity has been exceeded. And in certain areas in our trauma service area, we're looking at higher mortality rates than we are seeing here in Travis County. We have to put the brakes on now, and we have to take a serious look at those situations that are going to put more strain on what we're currently experiencing. So that's not a definitive answer to your question because the situation is fluid and it's going to require an assessment of all of those factors that come into play when we have large events. Things like the strain on our emergency systems, the strain on our hospital systems in particular. We've received some staffing, but it's not enough. And we would love to have an alternate care center, but we need staff in our hospitals first. So all of those things factor into the decisions that are made with regards to large events. I'm sorry, I can't be more definitive, but that's all of the, it's more complicated than a yes, no answer, so.
I appreciate that. And I know folks are paying close attention, both event organizers and people who would like to attend an outdoor event. And so I know it's really important in our community to keep our eyes on some of these other factors.
Yes.
We absolutely know, we want to make sure our kids at school are healthy and safe too. So I know that's a really big concern for a lot of folks. So I do appreciate your answer.
Thanks, sir.
Okay, thank you. Councilor Tovo.
Yes, thank you. Thank you, colleague, for the questions about that chart. Dr. Walks, I was going to suggest, I think that chart is a little challenging for general members of the public to understand. And so if you would send us all that extra information, I think that would be helpful. But, you know, I think it's super to have that kind of detailed information. And I wonder if what might help is just to have kind of a summary comment about what the conclusion is on that page, just so that all of us looking at it kind of get that main takeaway that you said, which I think was, as I understood it, that even with these variable rates, having a vaccine still provides protection, you know, a significant protection over the course of the next months. And so just again, I think having those kinds of summary comments paired with that detailed information might be a good way to just continue to emphasize that message to the general public. And thanks for providing that detail. I had two quick questions. One is if someone could please clarify for me whether the Travis County and city orders extend to schools beyond K through 12. It's my understanding that those mask mandates extend appropriately, in my opinion, to our community college as well as to our public colleges within the city of Austin and within Travis County. So that would encompass UT. And then my second question is, could someone on the call, I guess Dr. Walks probably, clarify to whom monoclonal treatments are available?
The masking does apply to everyone except UT because that's on state property. And the monoclonal antibodies are available to those who are at risk for developing severe disease. So that includes people with immune compromised conditions such as cancer, those who are taking anti-rejection medications after organ transplantation, diabetics, those who are over age 65, those who are in certain minority racial classes that have been historically disproportionately impacted by COVID-19, those who are over the age of, over the BMI, body mass index of 25. So it's a very long list, and it is at the discretion of the provider that's evaluating the person that is testing positive. It requires a referral from the provider, and then they're offered an appointment, and we have appointments available Monday through Sunday. So did I answer all of your questions?
I did, thank you, and I appreciate that. And I believe you may have covered this in a previous session, but if an individual believes they may qualify for the treatment or is uncertain but does not have a provider, what should they do next? Should they call 311 and get connected to a nurse line?
Yes, they can do that. And then there's some safety net providers in our city that can offer them services as well as telehealth lines that are available for that purpose as well.
Great, thank you. So if a person believes they may qualify but doesn't necessarily see themselves reflected on that list, they should call just in case because the treatment is.
Yes, and earlier rather than later because it's not available to those who would require oxygen therapy, or if they are somebody that does require oxygen as a routine, somebody that requires more oxygen than they normally would, or someone that would really be more appropriately treated in hospital. So as soon as you know that you're positive, reaching out to a provider for some guidance is the best thing to do because the treatment should be done within 10 days of symptom onset. So,
thank you very much.
Thank you for the question.
Councilmember Tovo, thank you. Those questions about the monoclonal treatment are real good questions. In a world today where we have such scarcity in our system and we're strained in so many places, the one place where we have capacity that's not being utilized is in this monoclonal treatments. It's the treatment that the president got. It's the treatment that the governor got. And it is available in our community for anyone who's at risk and then gets that referral. And if you don't have a primary care physician, as Dr. Walk said, call 311 so that we can get you to someone who does. But remember, it has to happen early in the course. You can't wait until you're in a tough place, because then at that point you're not eligible for it anymore. So people who are at risk, which is what this virus really does seek out, should really take advantage of that. Dr. Walks, I want to thank you. I know that you have appeared now in multiple court hearings, most recently the temporary injunction hearing yesterday in front of Judge Mauzy. I appreciate you sharing the factual information that you are with the court. And then we'll all wait now to see what happens with that. These cases are in the district court level and working their way up through the appellate court level. We appreciate, I meant to say a second ago, I appreciate the governor and the state in making that and standing up that monoclonal center that we have, because that's something that the state has done for us, and we appreciate that. We appreciate the staffing in the hospitals. We just wish there was more, because what we're getting isn't enough. But the courts right now, a couple courts are up at the Court of Appeals level. We have district courts doing temporary injunction hearings. Various parts of the state will work their way up. We appreciate that the Supreme Court hasn't ruled on the merits and is waiting for those cases to be developed to come to them, and we're all waiting to see. But I think that the cases that are moving up right now just really clearly identify the issues. It's about our kids at the highest priority, and the question is, can local school boards and parents provide the protections that all of the doctors and data say are necessary for our schools? Dr. Walks, do you anticipate getting here sometime soon your guidance with respect to large events, kind of the protocols that ACL is using? I know that there are other venues that are reaching out asking for the same kind of advice or how to look, and I know some of them individually have gotten to you. But do you have a general time frame for when you're anticipating being able to get out your analysis of how large events impact infections and what's necessary to keep that number down low?
I believe that we're planning on setting up a meeting sometime in the next 24 to 48 hours to talk to both you and Judge Brown and City Manager Kronk. So they should be out directly.
Sounds good. Thank you for that. And again, I want to thank the constable and the chief and your office and Director Stirrup's office. Everybody's working really, really hard to run this effort. So thank you. Look like people have raised their hands. Councilmember Alter, real fast. I know that Judge Brown is trying to get back to his meeting.
Yeah, I didn't have a chance to ask a question. So I wanted to ask my question. So I wanted to, first of all, congratulate all those folks who had a great start to school, and really appreciate all of the students and teachers who chose to protect themselves and others by wearing masks. I know from my son that, you know, folks were complying, and at least at his high school. And so I wanted to congratulate them on doing that and thank them. My question has to do with the FDA approval. It's my understanding that the original orders from the governor did not apply if there was a FDA approval. So I'm not exactly sure who can best answer this, if it's Director Stirrup, the city manager, the mayor, or Dr. Watts. But how does that change the landscape for requiring vaccines in different kinds of settings, whether it is the city, whether it is, you know, one of our local universities, whether it's the school district, whether it's employers?
And so we are still getting that complete analysis from City Legal. The attorney that I was conferring with yesterday said she needed more time to look into it. And what she said was it does give us some more leeway, but she believed there was something in the order that she wanted to check out before she gave us full guidance or advice. So we are working to understand what that means for us as a city.
But I certainly hope that all of those folks who said that we needed to wait on approval will now take the important step of getting vaccinated or allowing us to further encourage vaccinations more forcefully now that there is approval for one of the vaccines. Thank you.
Okay. Before I pass it off to you, Judge, just one last thing real fast to demonstrate the efficacy and the impact of the vaccine. If you forgetting numbers happening around the world, forgetting numbers happening around the country or even around the state, just looking at what we're looking at in Austin right now, the chances, if you're unvaccinated, of ending up in the hospital are not twice as great, or 4 times as great, or 8 times as great, or 16 times as great. You're 17 times more likely to end up in a hospital here in Travis County if you're unvaccinated than if you are. So we are hoping that people take a look at the new information and data. With that, Judge, we'll turn it back to you.
Thanks, Mayor, council members.
Judge, I just have a quick request before we end the joint session, and that is for future briefings, if the staff can begin to talk in specific terms about how we will prepare to roll out the booster program. I just don't want to repeat the confusion and the chaos that happened when the first round of vaccines became available. I think we need to be clear with the public about how we intend to do this. So I would ask that that be part of our future briefings, our joint briefings. Thank you.
Dr. Walks, do you want to address that? Or
It's a request for future briefings. I don't think we need a whole lot of discussion about it now, but I think the public will want to know that information and will need to know it.
Yeah, I'm just seeing if they have any updates for us right now.
And so there is no different process. You can walk up to any site where APH offers a vaccine and request your booster. You can register through Austin Health Force in the same way that you might have registered for your first round of vaccinations. Of course, there's the screening questions that one will have to do either online or when they show up in person. I will say that your process will go faster if you pre-register online, but that does not have to be a barrier. And because there are multiple providers in community, and for the boosters, APH is not required to serve as a hub provider, we are not expecting the same type of mad rush for our services as we saw in January. But there is no different process. You can call 311, you can sign into your account, click the booster button or the third shot button, and schedule your appointment.
Thanks. And Chuck, I know that we've started talking to Community Care and Jason Fournier, Ascension, others that worked on these efforts early on, along with APH and Dr. Walks. And so maybe next week, Chuck, we could get an update from them to what Commissioner Shea is asking about. It does seem like since the data for everybody who's gotten the first and second shots, for example, is in Community Care's database already, there would be some less complications, but until it sounds like we still have some work to do to prepare for that.
We do, Judge, and as you say, we are in conversation with Community Care and decision to be made about whether we want to begin using an appointment-based system out at our drive-through site at the Expo Center, but again, that database exists with Community Care for the first few months of our vaccine rollout. And then we've also got Chief Bailey's database as well. But those decisions are still to be made. And fortunately, we do have a little more time, Commissioner Shea, than we had last time around. But we are actively planning, and I'll be sure and update you next week.
Awesome. Thanks, everybody. And thanks. So I guess we're going to adjourn now until, why don't we come back at 10:40? as the Commissioners Court, and I'll pass it over to you, Mayor, to adjourn.
Judge, thank you. We'll go ahead and adjourn the city's portion of the joint meeting here at 10:33. We'll try to gear back up at 10:45. Some people can participate remotely. I'll probably work my way down to the chamber. 11:45. See you guys then.
Thanks.
Lawrence, did you want to try your audio and video?
Just as sure as your name is good, you can rest assured. You're